for those who are joining us for the first time, um, we go through the presentation, and then after that, we'll have a time for discussion and answering your questions. So it's a little formal process because we want to keep it consistent for the individuals who will watch the recorded episode on YouTube. So I'll have you all like mute your mics if you don't mind, as we will begin in just a moment here. And thank you for joining us. Well, welcome, Rochester, to the October Equity Series episode. My name is Wafa Al Khalifa, and I work for Destination Medical Center as the Equitable Development Manager. And I'm here with my colleague, Chow Matala, who works for the City of Rochester as the Diversity, Equity, and Inclusion Director. I welcome you all to a new topic and a new episode. And before I pass it to our presenter for this month, I want to just remind everyone where you could access our library of previous episodes. I'm just noticing that the screenshot that I have on there says 12 videos, but I know that we have way more than that. We've launched the Equity Series back in July of 2023, so it's more than 2 years. So we have a good number of episodes that you will find there that you could go back and listen to the different topics that we have shared in the past 2 years, as well utilize the episodes as a professional development tool for your organizations if you want to share it to open discussions within your team and with your colleagues. So you would just have to go to the Destination Medical Center YouTube channel where you will find all the Equity Alliance Equity Series episodes. And then if you or your organization has any questions or more, if you would like to join the Equity Alliance, feel free to contact me or my colleague Chow Matala. Will be more than happy to discuss with you what are some of the best practices that the City of Rochester or Destination Medical Center have committed to in order to create a more equitable, vibrant community in Rochester. But for today's episode, today we would be very honored to have Julie Ruzek, the Executive Director for Cradle to Career, who will be discussing with us some information about Cradle to Career, the services that they provide. And the title for the episode today is From Cradle to Career, Driving Lasting Change for Rochester's Youth. I want to invite you all to listen and tune in for this presentation. And please use the chat, introduce yourself, the name of your organization, and if you have any questions as she's going through the presentation, we'll make sure that at the end of her presentation that we will read those questions and comments from you. So I'll pass it to Julie. Thank you so much for being with us today.
Thank you, Wafa. I am honored to be here today. So thank you very much for having me, and good afternoon, everyone in Rochester that's here today and maybe watching at a future date and time. I'm going to go ahead and share my screen. When Wafa and Chow invited me to come and talk to you a little bit about Cradle to Career, I really jumped at the chance because I celebrated 3 years with the organization in July, and we have made some incredible strides in our community. So I'm excited to share them with you today, simply because Cradle to Career, the work that Cradle to Career does is somewhat unique in our community. And not everyone really understands what we do. And I think the more important piece is how we do it. So I'm going to talk to you a little bit about that today. Wafa, just double checking to make sure that everyone can see my screen.
Yes, I
Looks
can
good?
see that. Yes, it
Okay,
looks good.
great. Here we go. Before I start all sorts of talking, I would love to engage you a little bit. So I invite you to think a little bit about this scenario. If 5 different groups are working on the same issue, what do you think helps or hinders their chances of making progress together? So if you would use the chat right now, and let's just start with help. If 5 different groups are working on the same issue, what do you think helps their chances of making progress together. Feel free to put your response in the chat. It can be one word or a phrase. But we're looking for something that helps their chances of working together. Available resources. Thank you, Sarah. That's exactly right. Communication. Yes. Patrick, the dreaded collaboration challenge. We all say we want to collaborate, and then when it's time to work in the same sandbox, boy, is it hard, isn't it? Complexity, absolutely, Al. Openness and being vulnerable. Yes. A form of communication and connection, agreeing on the process and the objectives. So a shared agenda. Thanks, Brian, for doing that. Understanding the other groups and the nuances that each group comes with. That's exactly right. Thank you, everybody. This is perfect. And I feel like I can just drop the mic and you don't need me to present because you already know how to do this. On the flip side, I think I'll talk a little bit longer. Let's flip it around. If 5 different groups are working on the same issue, what do you think hinders their chances of making progress? It's not Karen. Karen is just introducing herself. The timing's terrible there, Karen. We're glad you're
Julie.
here.
Sorry.
Karen would never hinder progress. Diffusion of responsibility is one of those, yes. I think we could maybe take a look at some of those, the items that you previously put in the chat earlier and put them in the negative. So lack of communication, lack of available resources, lack of openness and vulnerability, trust, lack of agenda. Those are all exactly right. So today I'm going to talk to you a little bit. Thank you, first of all, for sharing those. I'm going to make sure that there's in group think. That's hard. Brian also said hidden agendas. Thanks, Brian. Not knowing where to go, what our direction is. Also exactly right. Sometimes when we look at a larger system-wide issue that is very intricate, it is hard to decide what those next steps are. All right. Thank you very much. That was great. So this is the elevator pitch for Cradle to Career. Cradle to Career is a community-wide initiative that works to improve educational outcomes for every child in Rochester by transforming the way that partners work together. And we like to say that our unique value proposition is that last phrase, that last part of our elevator speech, transforming the way that partners work together. Cradle to Career does not provide direct service to children, youth, and families. Rather, we were created to convene those partners that do provide direct service in one way, shape, or another, and work on issues that no one entity could address on their own. A great example of this, and we'll get more into examples later, but one example of this is childcare. Childcare is a multifaceted issue. It involves some workforce issues, some child development issues, and we know that there's a lot of discussion right now in our community and other communities across the country that are trying to address childcare issues, and it shouldn't fall to one organization to solve those issues on their own. Other examples you'll see as I continue to present today. So this unique value proposition, transforming the way partners work together, actually has a formal definition, and it is called collective impact. So we do the work of collective impact. This is the formal definition. It is a structured form of collaboration where organizations from different sectors commit to a common agenda to solve a specific social problem using a coordinated approach and shared measurement systems. In layman's terms, this really means we come together as a community to better understand an issue that affects children, youth, and young adults, and we work together to solve it. We're solving that one issue that no one entity could solve on their own. Before I move on, there are a lot of people in this space, or a number of you, that are working with us or have worked with us in the past. So if you are part of the Cradle to Career initiative, would you give us a thumbs up, either with your real thumb or your emoji, so we can see? A lot of you. Thank you. And the ways that people show up in Cradle to Career are varied. I'll talk a little bit about our networks and our work groups. I'll talk about our board. I won't talk a lot about our funders, but we do have those as well. And so there are a variety of roles and ways that you can be connected to the work of Cradle to Career. One thing I'd love for you, and I'd invite you to think about today, is the role that your organization could or does play in supporting the work of Cradle to Career. Let's move on. So as I mentioned, the work of Cradle to Career is to convene partners. When we convene our partners, we are constantly driven by data. We use data, both qualitative and quantitative data, to understand some of those systems level or population level issues that we want to work on collectively. And then we start to implement strategies and measure them for effectiveness. So we are incredibly data driven. We also apply research and best practices that have been implemented in other areas of the country. We also build relationships. We are convinced that strong relationships with partners across the community and across the Cradle to Career spectrum are important to the success of youth in our community. We're also working to dismantle barriers, not just in education, but also workforce and more. And you will see hopefully today where education, workforce, and health outcomes intersect, because humans are humans all the time. And so it's very difficult to separate basic needs issues from education issues, from health issues. We're really trying to look at everything and then understand where we can have impact. We also amplify voices. So hopefully throughout today's presentation, you will see how we are doing that. And we really focus on amplifying the voices of those that are highly impacted by the issues that we are addressing, but have low access to being able to change them. So making sure that we use processes like community co-design, and qualitative data collection, that we uplift the voices of our parent council and other parent and student groups that exist across our community to drive the work that we're doing is key to our work. We create strategies and reimagine policies, and we work toward a shared vision of what citywide educational success looks like. This is a picture of our small but mighty team. So you can see on this screen that we are small. And so the work of Cradle to Career, we always talk about who is the we. The we cannot just be I can't do math very well right now. 7 of us that you see on the screen, 8 counting Winnie. The work of Cradle to Career has to include our partners and all of you who are interested in joining us. So when we talk about we talk about our network members, our staff members, our funders, our board. We are all C2C. We are all Cradle to Career. And when we think about that, we start to understand a little bit how we fit into a larger network of collective impact work. So we are one of 75 communities across the country that are doing collective impact work, specifically under an organization called Strive Together. And if you're interested in collective impact and would like to learn more, I would highly recommend visiting the Strive Together website. Within the state, so that's national, within the state, we are one of 9 communities in the state of Minnesota that are doing collective impact work. There are 4 in the metro area and 5 that are outside of the metro area. And we come together as a state coalition to really understand and build a policy agenda every year and understand what each of our communities is working on and where we have alignment and how we can drive policy change at the state level. And then locally, we used to say that we were the only initiative of our kind doing this type of collective impact work. But more recently, the work of Any Path Home is another example of collective impact work. So groups coming together to address housing and housing instability are doing that under the Any Path Home umbrella, very similar to the work of Cradle to Career. I won't read these to you, but you can also see on the screen that we have 5 shared goals. And those shared goals actually align with the next slide I'm going to show you. And this comes from our national organization, Strive Together. And I think this is really important, especially when you are considering your role or potential role that you could play with Cradle to Career, because many of you may be sitting and listening today saying, my organization doesn't have anything to do with third grade reading or middle school math. It may not. However, I would love for you to consider where you may fit on this spectrum, especially when we start talking about post-secondary completion and some of the work of our high school group, our high school network, when we start talking about work experiences and partnerships that we could form to support youth so that every student in our community has opportunities to do work experiences and understand what their next steps are for the future. So what you can see here are really those outcomes that we are looking at. We call them population level outcomes that we look at all of the time and understand where is our community at each one of these developmental areas, starting, I would say, even before kindergarten readiness, anything to do with kindergarten data, really prenatally, and driving toward economic mobility. So the ultimate goal, as you saw on our elevator speech, is that we want to every child and young adult to succeed educationally so that everyone in our community is more economically mobile. So that is the largest driver, as you can see on the screen, of all of our work. So you may be wondering, okay, where specifically is Cradle to Career working right now? We have 3 work groups, which I'll talk about in just a little bit and get into a little bit more detail. But I wanted to show you on this, in this picture, a little bit about where we're currently working. We have a work group, or we call them networks. We have a work group working at the prenatal to age 3 network. This is really driven by data from Olmsted County Public Health that looks at a pregnant person's access to adequate prenatal care. So we started partnering a couple of years ago to really start thinking about in utero what a child needs in order to be welcomed into the world and ready to grow, learn, and develop. So that's our first network. Our second network is called Transition to Kindergarten. That network focuses on data and issues around the age of a child from roughly 3 to age 5. And then our third work group is our high school graduation work group that really looks at graduation rates for students across our community. And one thing I'd like you to take a look here is that our initial work groups have started at places in the trajectory where children and or families are transitioning to something new. So transitioning to having a new baby in a home, transitioning your child from early childhood into the kindergarten or K-12 system, transitioning a high schooler from the K-12 system into a career or college or university setting. And as I mentioned before, when we convene for collective impact, we have really found that those transitional areas are great places to start because a lot of work needs to happen at those times. And there's not always one entity or one organization that owns all of that work. We can come together to ensure that children have a smooth transition from early childhood to kindergarten. We can come together to make sure that young adults who are graduating understand what their next step is and what that looks like. So eventually, as we grow and mature, we've been around since 2018, so we're still relatively young. Eventually, we see ourselves having work groups along this entire trajectory. But to get started, we really are focusing in on those moments of transition. All right, so I've been referencing this, but how are we organized? And I should also say every picture that you see today is real. They aren't stock photos. These are real photos of our partners and our work. So if you see yourself on there, give yourself a shout out. We cannot do this work without our partners. So we are organized in the following ways. We have our collaborative action networks, also called work groups. Currently, we have those 3 that I just mentioned, prenatal to age 3, transition to kindergarten, and high school graduation. Upcoming work groups that we're kind of anticipating are our post-secondary preparedness work group and potentially a workforce work group. I will say when we talk about high school graduation and post-secondary preparedness, organically, we're already starting to engage with some of those partners in post-secondary as we look at financial aid completion and work experience. So sometimes this happens organically. Another piece of our work, as I talked before about centering and uplifting voice, is really to make sure that we're civically engaged and we understand the voices of parents and family members and students across our community. We know that we have many communities within our community, and it's very important to us that we hear from as many as we can as we are deciding what our next steps are and looking at our data, so that we are bringing back as much feedback to our network groups as we can. Data and research is key to how we do our work. So we have a dedicated staff person that does data and research and connects with other data and research folks in the community. Communications is key. People need to know not only who we are, but what we're doing. Our leadership table, this is the group of people that serves to govern our work and exists right now as 24 members, 24 leaders from across the community. And I believe there are a couple of leadership table members, Wafa being one of them, on this call today. And then finally, Cradle to Career, as I mentioned before, and Tawanda, thanks Tawanda for the thumb. Glad that you're here. Cradle to Career was started as a community-wide initiative owned by the community. So it was really important in the birth of our organization that we had some backbone supports to get us up and running. And so since the very beginning, Rochester Area Foundation and the United Way of Southeast Minnesota have served as Cradle to Career's backbone partners, both for our fiscal support and for our human resources employment support. You by no means need to read every word on our strategic plan, but I did want to call out the 4 buckets of our work, because as I continue to talk a little bit about our initiative, I'm going to talk about the pillars that we use to drive our work: shared community vision, evidence-based decision-making, collaborative action, and investment and sustainability. All of this comes from our national organization Strive Together's theory of action. And there are named benchmarks that we need to be meeting as we develop and work towards transforming systems in our community. One thing that we're really proud of are the yellow stars that you see on this strategic plan. These are benchmarks that we have already met and are moving on to the next benchmarks as we continue to formalize, grow, and expand our work. So with that, I'm going to jump in a little bit to talking to you a little bit about each of those pillars and what that means in Rochester. So the first one was shared community vision. The benchmark I really wanted to highlight today was the youth and family co-development. I referenced this earlier in my presentation, but it's imperative to us that we are engaging with those that are highly impacted by but have low access to changing some of the issues that we are talking about in our work groups. And we do this through mostly the community co-design process, where most of our staff have been trained either in the understanding of co-design or the facilitation of co-design. And these are just a couple of examples through our parent council and one of our co-design groups that we have really utilized kind of in the beginning stages of understanding our work, so we can bring those voices to our networks and say, here's the issue. This is what our community co-design and those that they engaged with think about the issue. This is the direction that they would like us to take. And let's consider that as we move forward. What we have found in this process is that, and this is also best practice for co-design, this isn't just about checking the co-design box, doing co-design, and then moving on to doing whatever you want to do. It's really about continuing to keep your co-designers engaged. And a number of our co-designers, after they participated in the co-design process, ended up joining our work groups. So we're really proud of that, as well as continuing to go back to our co-design group as we develop strategies and tactics and ask them, okay, here's what we're thinking about doing. Does this still match what you wanted us to do in the first place? So those are two ways that we're using co-design, and we're really proud of that work. In evidence-based decision-making, this is, again, about our initiative being data-driven. Data drives everything we do, both, and I want to make sure I say this again and again, both the qualitative and the quantitative data. We look at quantitative data a lot, and we also look to understand the stories behind that data, behind the trends, and then make sure that we're understanding those before we move on. So what you can see here is some pictures of our spring retreat with our transition to kindergarten group. We make sure that we go visual with our data, and then we spend a lot of time looking at the data, the disaggregated data, understanding those stories, and really discussing, okay, what is this telling us, and how do we need to move forward next? Now I'm going to talk a little bit about collaborative action, and this is where I'll talk about the work of our 3 work groups. I mentioned before, we'll start with prenatal to age 3, the network that's really addressing before a baby is born. And we did this because the county came to us a number of years ago with data they had been looking at. And this is the most updated data around access to adequate prenatal care. And something they had been looking at, and we were starting to research ourselves, was the same data. And what we have found is that since 2011, our community is accessing prenatal care less than the state average. And I'll say that again. Our community is accessing prenatal care less than the state average. And that the state average is this yellow line that you see going across the screen. And when we disaggregated that data, or I should say the county disaggregated that data, we found that there were 3 specific groups that were accessing prenatal care at an even lower rate. And those were pregnant people that identified as Black or African American, aged 15 to 19, and or had less than a high school education. So after extensive understanding of this data, a co-design process where we were able to engage with people from these communities and others, the work group really came to some decisions about next steps. And you can see that on the right-hand side of your screen. And that was to really collaborate with OBGYNs, midwives, pediatricians, WIC offices, and community organizations to increase awareness and access to doula support. And you might be asking yourself, why doula support? As we researched strategies to impact prenatal care and started talking to communities across the country about what they had done to increase this population level data across time or over time, doula support and access to doula services kept coming up over and over again. So we currently have 2 pilots that are being implemented and measured. One is clinician education and provider and increasing provider doula relationships. And we have scheduled some meetings with both Mayo Clinic and Olmsted Medical Center to start these conversations. Our second strategy really is around community education. How do we start talking to our community a little bit more and educating the community around doula support and doula services? So that's the work of the prenatal to age 3 group. And I mentioned earlier, when we talk about educational outcomes, this is a great place where educational outcomes and health outcomes intersect. I'm going to move on. I'm not used to continuing to talk like this without answering questions, but I'll get there so we can do some questions. Our transition to kindergarten network, this network has been working the longest. They're our longest standing work group that has been in existence. And one thing I want to note from the very beginning of talking about this work group is that it's very difficult to find population level data for children prior to kindergarten because they are in what the practitioners call mixed delivery settings. So children are coming to kindergarten from a variety of different settings. a childcare center, a daycare, a home daycare, a neighbor, a family, at home. There are all of these different settings where they may be, and there aren't a lot of population level indicators that can be used to understand how that population is doing overall. I will say, however, there are a few that we are continuing to research, and some legislation from the state where a new kindergarten fall assessment will be implemented in school year 27-28. So this has been a little bit more difficult for us to understand what population level indicator we can impact, because we're still looking for that really solid population level indicator. In the absence of that, though, I will tell you that a lot of the research we've been doing over the last couple of years points to some pretty specific needs around mental health supports and social emotional learning supports, not only for children aged 3 to 5, but also for the adults that care for them. And so that is one of the things that we're starting to work on. The strategy is to enhance adults' understanding of social emotional learning needs to promote equitable outcomes. We also did a community co-design around this topic. And one of the most interesting things, and there were many that we started to understand, was just some language inaccessibility. When we talk about social emotional learning, that tends to be education speak or teacher speak. And parents and families at home don't talk about social emotional learning all the time, but they may talk about sharing and taking turns and expressing your emotions. And so through our co-design process, we started understanding that we were getting in our own way by the language that we were using. And we can do a better job of using language that's accessible to children and families. So you can see on the screen 2 pilots that are also just beginning are understanding home visiting programs across our community, and to include, so that we can include cross-generational SEL, this is the acronym, social emotional learning education. And then also we're exploring what community-led programs look like that have cultural navigators, that are using cultural navigators rather, to address emotional regulation needs of adults by utilizing strategies such as modeling and role play. This is our final network group. And then I'm going to move on to a different topic. But this is all of this work is so exciting. I probably am doing it too much, my family would say, but I'm so motivated by the work that we do collectively that I just love talking about it. But one of the things that we looked at in terms of high school graduation rates a few years ago was that there were 2 specific populations: our Hispanic or Latino students and our Black and African American students were not graduating at the same rates as many other populations. And so once we really disaggregated that data and started understanding the stories behind that data, one of the things well, 2 things came out, and you can see them in our work groups. One was that students and families needed more support completing financial aid applications. And another was that students and families wanted more opportunities to work-based learning or work experiences. Currently, there is no formal system for either one of these things. It's kind of like, if you can find the resources to find someone to help you get this done in terms of financial aid, or you can find somebody who has an uncle who's a mechanic who can get you in to do some work experiences, then you're in. But if you don't have those connections, sometimes there are students that go without those experiences or supports. So our 2 work groups are really working to ensure that every kid in our community has the opportunity to work with someone to complete financial aid, to have experiences within the workforce prior to entering the workforce, or any type of career path or higher education opportunity where they would be deciding what they want to do. What you see on the screen is the Rochester Public Schools 4-year submission rate for financial aid. And one thing that we are really, really proud of is our numbers. We've been doing a pilot around helping students and families complete the financial aid process for the last 2 years. And every year we're helping more students and families complete, which matches exactly the overall rates. Every year we've been seeing the overall rates for completion go up in Rochester Public Schools. I could go into even more detail about this, but we're seeing success both at the individual level and at the population level. In terms of investment and sustainability, that's our fourth pillar. One of my goals as the executive director is to ensure that we have multi-year revenue. This is hard for a nonprofit, for most nonprofits, but we are seeing some success with local funding, multi-year revenue through local funding and state funding. Not so much for philanthropy yet, but I'm working on it, and fee for service. So those are areas that I continue to focus on for our initiative. And then I also wanted to bring up our parent and youth groups, what they are focused on. Every year, Beth Martinez, Beth is on the call. I love you, Beth. Works with our students and families to understand hopes and dreams that families have for their children. And that hopes and dreams data really grounds us in our why we're here and why we're doing what we're doing. And we also share that with our networks so that they can find alignment between the work that they are doing and what families desire for their children. It's pretty amazing to take a look at that. And someday I would invite you to bring Beth on this call so she can talk specifically about what we're hearing from families in terms of what they hope for their children in this community. Beth also works with all of our parent groups and youth groups to make sure that there's alignment between groups and conversations, and that there's ongoing and multi-directional feedback that's happening so that we can continue to do with, not to. This is one of my favorite slides, but we're running out of time and it will probably bore all of you. But what I want to show you is that in under 2 years, when we're taking a look at our benchmarks on that theory of action, we have grown in one category by 45% and by 83% in our upcoming category. So we are really assured locally by the work that we're doing, but also nationally by our national organization that we are on the right track. So now let's talk a little bit about moving ahead and celebrations. One of our biggest events of the year is coming up on October 29th. And so if I have at all intrigued you about the work of Cradle to Career, I would highly suggest that you check us out on October 29th. This will be our 4th annual education summit, and we've changed our location. We will be at the Mayo Civic Center this year because we have outgrown our previous location. Thank you, Mayor Norton. This is perfect timing. I see your thumb because we are also partnering with the mayor's office this year to offer an evening keynote. And we know that in the previous years, just offering a session during the day made it somewhat inaccessible for those that are working directly with children and youth to attend our event. So through our partnership with the mayor's office, we'll continue to do our regular day of programming, but the mayor's office is helping us bring our keynote in the evening. Dr. Amit Sood is going to be joining us for our evening keynote to talk a little bit about well-being and wellness and resiliency and joy. We need to remember that joy is a part of our work and how we can center that in everything that we do. So I highly recommend that you check out our summit. You can see the link on the website. And I think it's already in the chat. And I will say we set a goal this year for attendance and we're about to meet it. So if this is at all interesting to you, please register ASAP. It's free to the public, and that's important to us as well in terms of accessibility. So if you want to attend, we want to try to work with funders and underwriters and grant writing to continue to make this a free networking and professional development opportunity for anyone in our community that's interested in the work that we do. A few other celebrations. I've talked to you a little bit today about our active networks and work groups. and our solid and growing relationships. When I came to Cradle to Career, there were great people at the table ready to do the work. When I look back and I look to where we are now, what I would say is we're doing the work. We have a clear, defined strategic plan. We have people at the table that are willing to do this work, and we're doing the work. So that's a huge celebration for us. We have an interactive website and a social media presence. So this is a shameless plug to please like and follow us on social media networks. I already mentioned our education summit coming up. Please consider attending. And then contact us if something sounded interesting to you, if one of our work groups, our leadership table, our parent council sounded interesting to you and you'd like more information, please contact us for more information. And if you're not wanting to be directly part of the work, but you like the work that we're doing, pardon me, please share us. Share out our work. And then finally, we're growing. We anticipate hiring 2 new staff in the coming year. We have 3 student interns right now from the University of Minnesota, Rochester, 1 student intern from Rochester Public Schools, and we will be welcoming a groundwork fellow from the AmeriCorps in November. So we also want to make sure that we are living our mission here at Cradle to Career by creating work experiences for youth so they can understand, maybe I want to work in nonprofit someday. And then again, our hope in the future is to open at least 1 to 2 new networks relatively soon and to continue to broaden and deepen our work. This is how you can like, follow, and share us. This is our handle. And I'd like to close with this quote. Rivers do not drink their own water. Trees do not eat their own fruit. The sun does not shine on itself, and flowers do not spread their fragrance for themselves. Living for others is a rule of nature. We are born to help each other, no matter how difficult it is. Life is good when you are happy, but it is much better when others are happy because of you. And that comes from Pope Francis. I'll end here with any questions.
Thank you so much, Julie. What a great presentation. Thank you so much. I am gonna stop your sharing here so we can open it up for our attendees if they have any questions. And I do see Council Member Patrick Ian has his hand up, so go ahead. You're on mute. You're on mute, Council Member.
Thank you for that. I mean, I've watched this from 2018, the forming meeting, so it's really impressive, and I'm very proud of my community when I see the progress you've made. And I really love the way you guys had the discipline to make sure that you're, in terms of data-driven and critical success factors. In the city, we try to use the term key performance indicators. But all that said, I worry about taking school age stats right now, just after and just during COVID. How are you like handling data that comes from the COVID era? Is it an exception? Is it you're just using it as any other time? Or how are you treating that?
That's a great question, Patrick. Thank you so much for asking. I mentioned earlier the juxtaposition between quantitative and qualitative data and really understanding the stories behind that data. So even when we take a look at financial aid completion rates, I think is a good example. We saw, am I still sharing? I think I am. Am I not? I'm
No,
not.
you're not. I stopped your sharing.
Okay, I'll just go back and use this as an example. The 24-25 cycle, which was last year, and it was actually the year where financial aid was very difficult to access, becomes kind of an outlier. And when we talk about growth and success, we have to understand what was going on contextually that impacted those data and what that looked like. So we take a look at trends. Trend data is really important, and we understand that if there is a dip somewhere, we go in and we look at the stories behind those trends. and make sure that we're naming things like you said, council member, COVID, what happens after COVID, and what we can do moving forward. So my answer to your question is yes, we use that data, and we work really hard to contextualize the data with story and understanding so we are able to move forward.
Thank you. I want to invite everyone to utilize the chat if you don't want to unmute yourself, but if you have any question or a comment that you would like to share. And as Julie shared, all this amazing information about Cradle to Career and the services and the opportunities that we can all engage. If all of you would like to think about how does education show up in your organization? Um, how are you connected to education? Where do you see an opportunity? And you could definitely use the chat, or if you would like to unmute yourself.
Alan here. I seem to not able to raise my hand for some reason.
Oh,
So I,
no.
so I will ask a question in terms of, I recently noticed data from the school district, public school here, about the MCA result that identifying that the African American and Latino populations are not performing as well as the other groups. Now, I have a question in terms of the Asian, population, that I think there may be some more drilling down in terms of the different groups, subgroups within the Asian community. I'm worried that the subgroups are not being looked at, even though the overall population seems to be doing fine. In fact, very close to the white population. But my sense is if you drill down a little deeper, you'll find the disparity within that particular larger group. And there's something that I wanted to raise. And then if you really drill down, from an evidence standpoint, and you indeed find out that even the subgroups are doing, well, then is a place where exploration probably needs to take place. Why is that, happening? If there's the subgroup that tend to be the refugee group and the earlier immigrant group, as opposed to the typical, the Chinese group or Indian group that come from economically uh, prosperous, groups and education parents. So I guess I was want to raise that as a work item to identify that is an area of exploration and maybe even uncover certain disparity that ought to be looked at more critically that I'm afraid is being overlooked.
Al, I'm really glad that you brought that up. Thank you very much. And what you just described uh, is the work that the networks are doing. We don't have work groups right now in third grade reading and eighth grade math, but that's not to say that we're not tracking that data and working with the school district to understand it. But I think a key point, you've made a number of really important points, but a key point is that drilling down. We disaggregate all of our data and we look at those disaggregations and start to ask, we do a strategy called the 5 whys. We start to ask ourselves, okay, why is this happening? Answer that question. Okay, why do we think that's happening? And we keep asking why until um, we get to a more specific answer. And when I say we, again, I'm not just talking about the 7 staff. I'm talking about the collective, the network. We go then to our parents. We go to communities within our community, and we say, why? What is the disconnect? What's not happening for you? A key example of that is within our high school work, where families said to us from those 2 populations that I named, we need help with completing financial aid. Either within our family, we haven't completed it before, or we need other supports, or maybe language isn't our language. There are a variety of reasons why. Um, and if we investigate those whys, we can put some strategies in place that address them and then ultimately, the goal is that they impact that population level outcome. So you're exactly right when you talk about our community's need to continue to drill down and understand disaggregations. It's key. It's key. So thank you.
Thank you.
On a unrelated note, though, I think number one, your work is incredibly important. That there was, as I was going through much of the school district's data related to those subgroups, that the African American community, for example, I think was up 10 points or something. I mean, there's good progress in a number of areas too, which is
Absolutely
really,
right.
really great to see.
Yep. Thanks, John. And I think that's another key point I probably should have been more clear about. We're looking at assets as well. How can we really celebrate something that's successful and then see if it's able to be replicated in other places or spaces? So thanks for bringing that
Thanks for what you're
to
doing.
the
Thank you.
attention.
Julie, I do have a question that I prepared for your presentation here as we're waiting for more questions from the audience. Since we do have this variety of audience members here from economic development to construction company owner to nonprofit organizations, how important is it for the continuation of successful Cradle to Career for the other organizations to engage with you early on? As from an economic development, we talk about workforce trends that we're expecting and projecting all these opportunities. How important it is to invite Cradle to Career to all these opportunities.
Well, I think you know what I'm going to say. Very important. If all of this is driving economic mobility, and we want to, I'm looking behind you, Wafa. We want to be the destination medical center for our country and for our world. That means we need to have systems in place that support children, youth, and families from birth to career. We can work better together. We can have better understanding across systems, across organizations, in healthcare, in education. We can understand those overlaps and we can work smarter, not harder. And so the work of collective impact is so intriguing to me because there's a lot of good work that's happening in our community and it continues to be in silo. How can we come together and say, here's something that we're all passionate about. Let's work together to address that issue instead of working separately on it, where there may be then gaps and overlaps to the work. So I think if we all think about economic mobility driving this work, there's a place for you at the table. We just have to figure out where it is.
Absolutely. And then I really love how there is an awesome balance between data and quantitative information versus qualitative. I mean, you've utilized co-design in so many projects, and this is a prime example for all those in our community who have been interested to know more about co-design or have heard about co-design. Cradle to Career have been champions for co-design and they have used it in so many ways. Can you share a little bit more about what are the projects that you have used community co-design in?
Absolutely. And you can find all of them on our website as well. There's a drop down on our website that is called co-design under our data. I think it's under how we're doing. So feel free to access those reports there as well. We've done a co-design around understanding our childcare landscape in the community, social emotional learning supports, high school graduation. I can't even name all of them. We've probably done 5 or 6 co-designs. One I wanted to bring up, though, was the co-design we did when we were starting to understand more about access to adequate prenatal care. Because some of the proposed solutions that came forward from that co-design, they're all great. But an example I want to give to the group was around transportation. The co-designers named that getting to and from appointments was difficult, especially if you're age 15 to 19 and maybe you don't have a driver's license. That's one example. And so as we started to understand and think a little bit about next steps, utilizing the data we had from the county and the co-design to understand, all right, what are some strategies we can put in place and then measure for effectiveness? Of course, transportation came up right away. All right, let's do something about transportation. And then we paused for a second and took a step back, because if you think about the work of Cradle to Career as kind of an iceberg, transportation is right above the surface. That's an easy thing we can do, but it doesn't change something long term. And so the group really said, let's address transportation down the road, but let's start with building relationship. Let's start by really addressing how we can build and strengthen relationships between doulas and clinicians so that patients and their partner or families feel supported in that setting and are more apt to be using doula support. So co-design has been a key component to our work, and is also helping us identify some of the strategies we can put in place. I'll say they're more difficult to do, but they have greater chances of lasting change when we really start to organize them in that way.
Thank you so much, Julie, for the amazing presentation and all the information that you shared with us today. And we did share in the chat the link to register for the annual education summit. It's really amazing to see that you have outgrown the previous space that you used to host the summit, and to see it coming to downtown. That's really awesome. And we hope that everyone gets to register and attend, because it's very informative, some really awesome sessions that they're scheduled for this year. And I thank you all for attending with us today. I want to just share a reminder to everyone who is familiar with the Minnesota Young Leaders Program that the applications and nominations are open right now. So if you have someone in your network that you would like to nominate, or you want to apply yourself to be part of the 2026 cohort, the applications are open. The nominations are open till the 30th of October. The applications are open till, I believe, the 20th of November. And then for our next episode, it's going to be November 12th. And we look forward to seeing you in November. And I also want to mention that our December episode, it's going to be possibly an in-person event, and it's not going to be on Wednesday. It's going to be on the second Thursday of December. Just to let you all know, we'll be sending more information about that. Save the date, and more information will be coming up. Thank you, everyone, for joining us today, and enjoy the rest of your day, and we'll see you next month.